Infections of the upper respiratory tract have a tremendous impact on public health. They are among the most common reasons for visits to primary care physicians each year. Let us quickly go through the parts of upper respiratory tract to get a better idea about the infections of the same. Upper respiratory tract includes nasal cavity, pharynx, and larynx. Among all the upper respiratory tract infections, sinusitis affects a tremendous proportion of population. Sinusitis is nothing but the infection of paranasal sinuses. There are four paranasal sinuses, each corresponding with the respective bone from which it takes its name. Maxillary sinus, sphenoid sinus, ethmoid sinus, and frontal sinus. Although sinusitis involves more than one sinus, the maxillary sinus is most commonly involved. Each sinus is lined with a respiratory epithelium that produces mucus, which is transported out by ciliary action through the sinus ostium in the nasal cavity. When the sinus ostia are obstructed, or when ciliary clearance is impaired or absent, the mucus accumulates in the sinuses, producing typical signs and symptoms of sinusitis. Sinusitis is further divided into acute sinusitis, chronic sinusitis. Acute sinusitis is defined as sinusitis of less than 4 weeks duration, and it constitutes the vast majority of sinusitis cases. Chronic sinusitis is characterized by symptoms of sinus inflammation lasting for more than 12 weeks. We are mainly discussing here about acute sinusitis. The causes of acute sinusitis is broadly classified into infectious causes and non-infectious causes. The infectious causes of sinusitis include bacteria, viruses, and fungi. The non-infectious causes are deep sea diving, swimming, skydiving, or air travel. Basically, any activity that causes barotrauma to the mucous membranes of the sinuses. Other non-infectious causes include nasal polyps or deviated nasal septum or continuous exposure to chemical irritants. Infections being the most common cause of sinusitis, viral sinusitis is far more common than bacterial sinusitis. However, distinguishing the two is usually difficult because of the similarities in their signs and symptoms. The illness duration is used as a guide towards differentiating acute bacterial from viral sinusitis. Acute bacterial sinusitis is suspected when symptoms last for more than 10 days. Viral sinusitis, although being far more common than bacterial sinusitis, the signs and symptoms usually don't last for more than 10 days. If the symptoms of sinusitis persist for more than 12 weeks, it is termed as chronic sinusitis. It is thought to be due to the impairment of mucociliary clearance from repeated infections rather than persistent bacterial infection. Symptoms of sinusitis involve nasal drainage, congestion. Nasal drainage is initially bland and whitish, which may later become purulent. Blocking of the nose or nasal congestion occurs due to the swelling of the nasal mucosa. Facial pain and headache. Facial pain pertaining to the areas of sinuses along with headache is quite discomforting and are aggravated on bending down, coughing, and sneezing. Other symptoms involve sneezing and fever. Sneezing occurs due to the irritation of nasal mucosa. You may also experience low-grade fever occasionally. Tooth pain and halitosis. which means foul breath, are among the few uncommon symptoms of sinusitis. Tooth pain, most often involving the upper molars, as well as halitosis, that is foul breath, are occasionally associated with bacterial sinusitis, or it should raise a suspicion of a primary dental infection secondarily infecting the sinuses. Thick, purulent, or discolored nasal discharge is often thought to indicate bacterial sinusitis, but it could also occur in early viral infection, such as common cold, and is not specific to bacterial infection. Now, let us talk about the treatment of sinusitis. Your doctor may prescribe you antibiotics, anti-allergic, or painkillers, along with some nasal decongestants to reduce the swelling of nasal mucosa and promote the drainage of sinuses. CT scan may be advised to confirm an underlying anatomical defect such as deviated nasal septum or obstructing nasal polyps. Surgery may be advised in cases of chronic severe sinusitis or those with any associated complications. Now, here are some home remedies with which you could help yourself out to augment the path of cure by finding relief from severe discomfort. Hydration is the key. Drink plenty of water or liquids to keep yourself well hydrated. Steam inhalation. Steam helps to relieve the congestion by loosening the mucus, which may flow out easily. Plain water steam is always effective, but you may add menthol or camphor into it if you like. Warm compress. Rotating the warm compress over the location of sinuses and areas of pain would help in soothing out the acute discomfort. Rest. Allowing your body to rest can help reduce sinus pressure, speed up your recovery time, and leave you more refreshed. Please do consider to like, share, and subscribe the channel. If there is any topic on which you would like to discuss, please let me know in the comments below. Thank you for watching.